series. We're on the new patient orientation, and I think this is number 4. So here we go. Let's get our timer ready. So last time we were talking about, we were going through some of the reasons how you get subluxated. So accidents, falls, sports injuries, trauma, repetitive movements, poor posture, chemical stress, emotional stress, nutritional deficiency, the birth process, childhood, falls, and accidents. We had just finished that. We talked about accidents happen, and I actually got hit by a torque bus, and that's how I became a chiropractor, because I got hit by a bus and I could not get well, taking medicines or prescriptions, or I did therapy, and finally I was supposed to get surgery, and while I was waiting to get surgery, I went to the chiropractor, and he adjusted me, and my body healed itself. I was able to move and walk. So one of the reasons you do get subluxated is by accident. So, and then I think we had just finished that, and we were talking about as you get as you start to get adjusted and your subluxations start to go away, then you start to get more nerve function and you start to get healthy. And it does take some time. So let's start our 5 minutes. So what's next? So lifestyle changes. Why? Stress happens. You have to do a little bit more than just get adjusted. Even though when you get adjusted, it does improve your nerve flow, and does increase your optimal cell integrity. But stress happens in life, and so you got to get ready for it. So lifestyle changes will help you adapt and be able to deal with stress. So your body's programmed to respond to any perceived stress in a very predictable and consistent manner. As a result, your physiology will respond to the combinations of physical, chemical, emotional stresses that you experience. Understand that this is a perfect response, and is there to increase your likelihood of survival to stressful situations. Your body does not know or care if the stress is from real life-threatening situations, like confrontation with a tiger, or perceived stress such as completing and paying your taxes. The body response will be the same. So, your body responds to stress in a certain manner, which we're going to go through next. Understanding this response, and then understanding that one of the primary keys to your better health is the ability to inhibit or shut off this response, is critical to any wellness program. We intend to share this response with you and show you how your diet, exercise, as well as your thinking all determine your response to life stresses. So when your brain perceives a stress, if it's good or bad, the sympathetic and flight portion of the nervous system is stimulated. So the symptoms are being revved up, edgy, inability to relax, sleep, constricted of the arteries, increased heart rate, blood pressure in your body. This nervous system is in the fight, flight mechanism, so it's getting you to try to get you out of a stressful situation. So your nerve supply and blood supply of the guts is decreased, and the periphery is increased. So the symptoms are decreased digestion, acid reflux, bloating, constipation, irritable bowel. The nervous system decreases reproductive hormones. So symptoms are sexual dysfunction, lack of drive, pituitary decrease, growth hormone. So the symptoms inability to build muscle. So the adrenal glands release adrenaline, epinephrine, and cortisol. So symptoms are increased blood sugar, hypoglycemia, and diabetes. The cortisol causes the liver to reduce HDLs, good cholesterol, increases LDLs, bad cholesterol. Symptoms, you get high cholesterol and increased cardiac risk factors. This increases cravings for sugar and for fatty foods. So, and then your adrenal hormones stimulate the amygdala, which is the emotional center of the brain, to call on previous memory. So that same time logical thinking centers are inhibited. So you have difficulty remembering and learning new information. Cells of the hippocampus have actually been shown to shrink. So your body is going, it's trying to get you out of a stressful situation. It doesn't need to remember like a name or a number. So, if you never get out of the stress cycle, these are the symptoms that you're going to get. So adrenal hormones increase senses of touch, smell, hearing, and sight. So symptoms are easily distracted, poor attention, increased sensitivity, and heightened pain perception, like fibromyalgia. So the flight-fight response will also result in decreased sleep. So shortening even one night's sleep by 4 hours causes a significant reduction in insulin receptor sensitivity. And chronically, this reaction, coupled with high blood sugar, leads to type 2 diabetes, syndrome X, heart disease, obesity, cancer, and chronic fatigue. So in short-term stress, serotonin would be released to inhibit the release of noradrenaline to help and stop the stress response. But however, in chronic stress, serotonin production cannot keep up, resulting in depression, fatigue, and trouble sleeping. So the bad news, as these pathways are fired in the spinal cord and brain, the body becomes more efficient at processing them neuroplasticity and allowing you to move into stress physiology more quickly and effectively. So the good news is the stress response can be shut off. So you can see, we went through the stress cycle and what stress does and what and the symptoms of when you don't turn it off. So you can see, like, you're seeing more people have more problems due to the amount of stress that they have, and they're not shutting it off. So like lifestyle changes, which is one of the things that we do at Back to Life Chiropractic. The Back to Life system, deals with all this and helps us break this cycle. So we will show you how to proper lifestyle based on the principles of Back to Life Chiropractic Connecting Wellness Get Fit program. So what happens when we're stressed? So just a recap. So the good's burst of energy, heightened memory function, burst of increased immunity, lower sensitivity to pain. We just went over that. And then the bad is the impaired cognitive performance, suppressed thyroid function, blood sugar imbalance, decreased bone density, lower immunity, increased abdominal fat. So this cycle here is the stress cycle, which is a good thing in the short term, but if you never break it up. So the lifestyle changes that we do with the Back to Life system actually will stop this cycle, and then then your stress should hopefully be good, handled well. So the big question is, how do we know if we? Sorry, the 5 minutes up. So the next week we'll go, or the next time we do the new patient orientation for the 5-minute workshop, the big question will be, how do we know if we are subluxated? And what are the how in your health? What lifestyle changes do we need to work out? So we'll talk about that next time. So.